Welcome to Evan and Deb in the Evening, brought to you by Health, Wealth, and Wisdom, bringing you news and happenings from around the Bay Area and the medical, financial, and general wellness experts that help you live longer, stronger, and richer lives at any age. And now, from the Senior Voice America studios, here's Evan and Deb.
All right, we've got Cori Uccello with us. I hope I pronounced that right.
It's Uccello. Close enough.
Uccello, okay. And you're with the American Academy of Actuaries. So how you doing tonight, Cori?
Great. Thanks for having me.
So, the big talk, obviously, Obamacare, ACH, it's still out there. But, it goes hand in hand to talk about healthcare spending growth. And, it doesn't seem to be slowing down at any point, does it?
Actually, what's really interesting is in the past few years, health spending growth has slowed to historically low levels. So
now, wait, spending growth or the cost of healthcare? Which one's slowing, or both?
Spending growth has been slowing.
Okay.
Spending levels have continued to increase, but at slower rates.
Okay, gotcha. And so why is that?
Well, there's still a lot of uncertainty about why that's happened. People think that the recent economic downturn and the slow recovery have contributed to the slowdown. But there have been also been changes that started even before the recession in terms of how healthcare is delivered and paid for, and those changes may have contributed to the slower health growth as well.
Very interesting. And now you guys have launched, the American Academy of Actuaries has launched a new initiative focused on slowing health spending and improving quality of care. But let me ask you this. Is the importance slowing health spending or slowing health costs? Because those, I don't know. I mean, those are still increasing, right? The actual cost of health care?
So total health spending levels have gone up, but I think a key is to slow the rate at which they grow. I think that's important. And even though that we've had this slowdown recently, we don't want to be lulled into this false sense of security in terms of, well, everything's okay, health spending growth has slowed, because as you said, health spending levels are still high, and the spending growth rate could return to historic levels. And just in the past week or so, there was something I saw, some preliminary evidence that there has been a bit of an uptick in the rate of spending growth.
Well, now let me ask you this too, though. Will more people be spending on health care if they now feel that they're insured, all these people that were not insured before? And will hospitals, doctors, and the rest of them decide, hey, we've got more people that have insurance, we can charge them more?
Those are a lot of good points. I think over the next few years, we'll probably see an increase in how much people spend, especially those who are newly insured. And maybe those who had not so great insurance coverage before, but maybe now through the Affordable Care Act have been able to get more generous coverage. So what happens is when people face lower out-of-pocket costs for the care that they receive, they might increase their utilization. So, and at the same time, people who were previously uninsured, they may have some pent-up demand, meaning, they put off getting that back surgery or put off other things. And now you might see, especially in the first few months this year, and this may slow over the year, but people who put off getting care coming in and getting that care.
Okay. So now to slow health spending, tell me what the initiative is that the American Academy of Actuaries has.
So we are really excited about this, and because, like I said, we really think it's important to keep our eye on the ball here and remind people of the importance of slowing down health costs. So we're exploring options that will help sustain the recent slowdown and help further reduce costs, while at the same time at least maintaining or even better improving the quality of care. So the kinds of things we're looking at include looking at how health care is delivered. We just did put a paper out that looks at delivery system reform, and that involves whether and how physicians and other providers are organized together to provide care. So care that's more coordinated, such as accountable care organizations, those kinds of systems have the potential to both improve quality while at the same time reduce costs.
Right. Well, but here's my thought. There's a lot of hospitals purchasing doctors' offices now. Like my primary care physician is owned by one of the hospital groups. I'm hearing maybe the opposite's going to happen, because now that doctor has more of an incentive to send you to the hospital that he's working with, right? And I'll give you another example. This absolutely happens to me, and it's happened to me the last 2 years. I have to get an MRI. They decide every year, every 2 years, every 3 years, because I have a condition in my brain that's congenital from birth. Okay, so my doctor says to me, I want you to go to the MRI downstairs. That MRI downstairs costs me $800 more. If I go to the private MRI, you know what I mean, the company that, they've got 12 of them offices around the city, I pay $300. So these doctors that are attached to these hospitals seem to be raising the cost of health care.
Yeah, and again, you've brought up some great points here. In terms of hospitals purchasing physician practices, you are seeing more of that. And on one hand, it can be a good thing because they can coordinate their care better. But on the other hand, they could start charging more. And we're seeing this a little bit in Medicare, and some folks have raised some red flags on this, saying that, you shouldn't have to pay more because the physician is now associated more directly with the hospital rather than practicing alone. And in terms of your MRI experience, I think you're going to start seeing more health insurance plans really targeting your copay based on a low-cost provider. So they'll give you X amount of dollars for your MRI, and then you could choose wherever you want to go. But if you choose that higher cost provider, you're going to have to pay more out of pocket for it. So you have a more of an incentive to find and use that lower cost provider. And it also will give you a little more leverage of not just doing whatever your doctor says if you do see that there may be a conflict of interest there.
Okay, here's my idea, because you guys are looking at all this stuff. Tell me what you think of this. We're talking right now to Cori Uccello, and she's a senior health fellow at the American Academy of Actuaries. You're listening to Evan and Deb in the evenings, 1250 wins, WHNZ. Okay, here's my idea. We don't give anybody any money for health insurance. All this tax money we're getting, we don't give any, what do they call them, rebates or whatever you get if you make $40,000, $50,000, right? Okay, and I'm not being mean about it. I'm saying nobody gets a dime. You have to go get health insurance. You got to, like you get car insurance, you got to get health insurance, okay? You don't get any money. But all those taxes, those 9 new taxes that Obamacare's come up with, instead of giving the money to people for buying something that they really should buy to protect themselves and their family, we take that money and we give it to hospitals. And we say, you need an MRI machine and it costs you $1 million? We're going to buy it for you. But here's the price you can charge for an MRI. You can never charge more than $200, $300. Oh, you need this giant CAT scan machine? No problem. The American government's got the money. We're going to buy it for you. We're going to buy all this equipment for all these hospitals. And then we price fix what they can charge the public. That, to me, brings down the cost of health insurance. It brings down the cost of health care. Instead of just giving people a bunch of money to go pay for insurance, and to me, it doesn't really give them an incentive to say, hey, how can I go save money? Hey, fine, the government's giving me $1,000 a year, $5,000 a year tax break on buying insurance. Fantastic. They just are happy to have insurance. Is that crazy? What do you think, Cori?
Well, that's an idea, and I think maybe another way to think about that is something that, say, folks in Massachusetts have been thinking about is providing global payments to providers. So you get a certain amount of money for each insurance enrollee that you're responsible for, and that with that money you have to provide them all of the care. And so that's another way to
You're saying to
reduce the incentive to give too much care.
Are you saying to insurance companies they'd give the money, or are they giving it to the actual providers?
The providers.
Okay. Yeah, because something's got to be done. I think giving the money to the people, it just doesn't make sense. It's the wrong direction. And there's, you say, oh, well, these people make more money, so we're going to tax them and we're going to give it to these people. Why do that? Why shouldn't, if I make $200,000 a year and I have to pay all this tax, shouldn't I get some benefit? Isn't there something in it for me? There really isn't. I've got to pay all this tax, and then all these other people are going to get all the benefit. And not say that they don't need some benefit. But anyway, Cori, stay with us. I got a couple more comments and a couple more questions for you. Evan and Deb in the evenings, 1250 wins, WHNZ.
Now back to Evan and Deb in the evening.
All right, we're wrapping up right now with Cori Uccello. She is the a senior health fellow at American Academy of Actuaries, and you can find them at actuary.org is their website. So you guys work on a lot of different things. How can we get the politicians to listen more to the experts like, actuaries?
Well, what we've been trying to do here at the Academy is, we have several ways of trying to communicate with the policymakers. And I think part of what we try to do is take technical kinds of expertise and put that in language that's understandable, not just to the lawmakers, but to the public more in general. And I think just helping folks understand these complicated issues will help shine a light on some of these
I think
complicating challenges that we have.
Right. If we educate Americans better, if they're willing to be educated, let's be for real here, they're willing to read it, go to the website or order what they need to get. But, if they're willing to do that, they can make better decisions on who we're voting for in November, because the politicians, they do what they want to do, or they do what politically they need to do too often, and they don't look at this and go, well, the math doesn't work. It's like Obamacare. The math, we tell everyone we're going to lower insurance premiums, but we're going to give you all this other stuff, the math just doesn't work, right?
Well, I think it depends on who you're talking about. For some people, premiums could be lower now than they were before the Affordable Care Act. For others, they could be higher. Really, these kinds of things really depend on who in particular we're talking about.
Right. But when you look at the entire pool of insurance, the insurance has gone up. While for a handful of people it might have gotten down, and these group went up, but I think on average health insurance has increased, hasn't it?
Well, I think the bottom line here, and it's why the Academy is focused so much on health spending growth, is that that's really key to having a sustainable health care system, reducing the rate at which health spending grows. And so no matter what system we have, that's really key to making sure that we can afford the health spending in the future.
Hey, and if we reduce the spending on junk food and all that stuff, we will reduce the spending on health care, right?
Well, one of the factors contributing to higher spending is lifestyle choices. And if we can eat better and exercise more, that's going to be a good thing.
Absolutely. Cori, thanks so much for joining us. Find them at actuary.org. They've got a lot of great position papers and information there. Thanks again, Cori.